Hey, you. Welcome back to Chronically Playing, the podcast where we talk about what it really looks like to plan with faith, purpose, and flexibility while living with chronic illness. I'm really excited for today's episode because I had the opportunity to sit down with Dr. Megan Close. And y'all, this was such a warm and insightful conversation. She made me feel so seen, not just as a lupus warrior, but as a woman navigating all the layers that come with this diagnosis. Dr. Close is a professor of medicine and chief of the Division of Rheumatology and Immunology at Duke University. She's also the founder of lupuspregnancy.org, which are incredible resources for women managing lupus during pregnancy or family planning. In this conversation, we talk about the latest lupus research, why diagnosis delays are still happening, and what new treatment options could mean for our future. So whether you're newly diagnosed or have been living with lupus for a while, this episode brings both science and so much hope. So let's get into it.
Thank you so much. I'm really thrilled to be here.
Yes, I'm so excited to have this conversation. We've been looking forward to conversations like these. So first, I want you to get started with your story. Like, what actually inspired you to get into rheumatology and specifically work with lupus patients?
Absolutely. It's a great question. So I have wanted to be a doctor since I was 3 years old and always wanted to be a doctor. My grandmother actually had rheumatoid arthritis when I was little and was really sick with rheumatoid arthritis. So I sort of always knew about rheumatology and sort of thought about it, but didn't really have a plan to be a rheumatologist. And then when I was in medical school, what I learned is that I really liked talking to patients. I really liked hearing their stories and sort of helping them with quality of life as well as really complicated medical conditions. Like that's what I really liked was getting to know people, working with them for a long time and really diving into the complexities. And that is what rheumatologists do. We are the folks that get to know patients, get to understand their symptoms, and really get to then pull together all the little strings of symptoms and experiences and labs into a diagnosis, and then work really closely with people to get that better. So that's why I became a rheumatologist. And then I was in my first month of training, actually, and saw multiple patients in the pregnancy ward, like in labor and delivery, who had lupus. And I had trained at the same hospital. I didn't even know that we had babies born there. And I didn't know anything about pregnancy. And so I started exploring pregnancy as well. So a lot of what I do is lupus, and a lot of what I do is pregnancy. I would say I landed in lupus because so much of the pregnancy work really is in the lupus space. And so that's really how I started to get to know lupus patients really well and working with some lupus experts. And that's really how I sort of entered the lupus space, was really through my interest in reproductive health and pregnancy and really helping particularly younger women live really healthy lives.
Wow, that's cool. So when you were in there, you just mostly connected with the women that had lupus and were pregnant.
Absolutely. Absolutely. And sort of learning their challenges and seeing how medicine could help, how medicine sometimes can't help was really fascinating to me and really sort of a driving force in who I am now.
That's great. So many of people in my audience are navigating chronic illness while trying to advocate for themselves. What has worked closely with lupus patients taught you about their everyday challenges?
Yeah. I've learned a lot over the years for sure. And one of my favorite ways to learn from patients actually is I've run several patient collaborator groups where I really pull patients out of the doctor's office where there's sort of one sort of relationship and pull them into a small group of mostly women living with lupus to really understand what their lives are like. So I really have learned that a lot of the challenge of living with lupus comes from and many chronic diseases, but I think especially lupus is really big on this, is the sort of just general feeling of illness and the ongoing fatigue and ongoing achiness that it's really hard for doctors to kind of put their fingers on to say, this is what this is, and I know what the problem is. But one of the things that I really focus on in lupus is the day-to-day challenges of living with lupus, in particular fatigue and chronic pain and achiness. The other things that I think are really important and interesting and hard are taking medicines every day, right? So medical doctors, we sort of like assume that patients are just going to take their medicine all the time. But what I've learned is that that's actually really hard to do. And I've learned that from personal experience that like I miss medicine, but also that it's like a health behavior, just like exercising is and eating healthy and that kind of stuff that is hard to implement in your daily life and hard to do on a forever basis.
But especially when you have to pop 20 of those things. So it's like, I don't really want to do that. And then you end up picking and choosing which ones that you kind of just know will work.
Yeah.
And then you're not getting the full healing experience of what they're supposed to do because you're just like, oh, these 30 of these, you know? So yeah, that is definitely something that a lot of people, I think the doctors don't think about when they're prescribing.
Absolutely. It's definitely something that we think about a lot in our lupus group is like how many medicines are people on and is that a feasible number of medicines? Because doctors like to make it really complex and like sort of this really precise plan, but like patients can't actually take them. Like it's just hard to take 30 medicines. It's hard to keep them refilled from the pharmacy all the time, right? Half the time the pharmacy is like, oh, you can't get it for this reason or that reason. Some of them make you feel bad, right? And when you're taking 30, you don't even know like which one is making you feel bad or you think, right? And so, and we have patients who, and I suspect a lot of people listening who sort of like spread the 30 pills out throughout the day. So they're trying to like remember them and balance them. Anyway, so we actually take the challenges of medication, like taking medications really seriously in our lupus team. And one of my missions in this world is actually finding simpler medication regimens that people can actually do for long periods of time. And that doesn't mean 20 medicines, you know?
Okay. So with this, you've recently led a phase 3 study. Could you please further just save me the trouble of saying this name?
Yes. I had to practice it a lot. It's called dapirolizumab, I think, dapirolizumab. Sometimes we call it DZP. We actually call it dapimab.
Okay.
Get away with dapimab, if that's all right, or DZP. I'm sure eventually, once it comes to market, it'll have a fancy name that we can all say that the marketers will come up with. But dapirolizumab, yep.
Okay, so this is for people with moderate to severe lupus. Can you walk us through the purpose of this study in simple terms for someone who isn't familiar with clinical trials?
Absolutely. So the way that a drug goes from discovery to market and like that you can actually, your doctor can prescribe it and you can pick it up at the pharmacy, is it starts off with really small trials just to make sure it's safe. And then somewhat bigger trials to kind of figure out what the right dose is. Those are called phase 2 trials, phase 1 and phase 2. And this is what we call a phase 3 trial. So the phase 3 trials are what the FDA always needs at least 2 of them to see how well the medication works and does it do the thing that it's supposed to be doing for your disease? And is it safe enough? Are there any major safety problems? And they want to see the results of at least 2 of these phase 3 trials in order to approve the medication for use in the general population. So a phase 3 trial, they're quite regimented by the FDA. And the way that almost all the lupus phase 3 trials that have been done on all the last medicines for the last like 25 years have all basically run very similarly. So what you have to do is you enroll a group of patients who have a certain level of lupus activity. So for this study and most of the studies, you have to have either really severe manifestations or symptoms in at least one organ system or sort of moderate symptoms in 2. So you could have like a rip-roaring awful rash from lupus all over your body, and that could get you in the study. You could have bothersome rash and bothersome arthritis, and that could get you in the study. All right. So you have to have enough disease activity that we think we can get you better with the medicine and we can measure it, and that there's like a real reason that you need a new medicine.
Right.
Then everybody gets in the study, and then they get randomized. So a computer actually randomizes the people into either getting drug or getting placebo, which is fake drug, right? And then everybody is followed out for some period of time. Lupus trials pretty much always go for basically a year, 48 weeks, is how basically all the lupus trials.
Okay.
And then, so in this study, what they did is they enrolled a little over 300 patients, about 330 patients or so. About 200, a little over 200 of them got drug, got the dapimab, and about 100 of them got the fake drug. They all stayed on whatever medicines they were already on. So the majority of patients were on hydroxychloroquine. The majority of patients were on prednisone because they had active disease, so they were trying to get treated. About 60% of the patients were on some other immunosuppressant like methotrexate or azathioprine or mycophenolate, like that. They were not allowed to be on another biologic, so they couldn't be on belimumab. They couldn't be, which is Benlysta. They couldn't be on anifrolumab, which is the new interferon drug, which I just lost. Safnello, I think, is the other one. So they couldn't be on those medicines. They had to come off of those before getting into the study. All right. Should I keep going?
Yeah, no, I mean, no, because I wanted to know, like, what made this treatment promising enough to move forward into a larger scale trial?
It's a great question.
And, like, what were you and the team looking to improve compared to current treatment options?
Absolutely. Great question. So in the, so this drug is a medicine. It's a really specific drug that targets something called CD40 ligand, which is just one part of the immune system that actually is involved in activating a lot of different parts of the immune system. So it's not just one little thing, one little part of the immune system. It has it sort of impacts lots of different things, B cells and T cells and all sorts of things. And so there's been data on these medications actually for a couple of decades that have been slowly growing that it might be effective for lupus. So that's why they wanted to try it. And their phase 2 trials, when they did on a smaller number of people, were really promising and looked like it was going to be both safe and likely really helpful for patients with lupus. The key sort of symptoms and things that they were going after in the study was improving the symptoms, in particular, like arthritis and rash were the two things in particular they really wanted to improve. And then also they really wanted to help patients get off or on lower doses of prednisone. So that's something that's a little bit unique about this study and important is that, you know, it's well known that patients with lupus love prednisone because it's kind of one of the few drugs that really works well for almost all patients, right? You see a quick response. But we also know that it has the most side effects, actually, mm-hmm. medication, particularly if you're on high doses for a long time. And so kind of all the goals in rheumatology are just getting you comfortable and doing well, not on prednisone. So that was an important part of the study. So controlling symptoms, getting people off of prednisone.
So this might be an odd question, but I just really want to know, do you know what's in this stuff? Like, that's so important to know, like, what else are we putting into our bodies? You know, just trying out different pills and medications and things like that. Like, on top of trying to eat right and all this stuff, like, what is in this?
Yeah, so the main thing that this is made out of it's an antibody. So, you know how we all have antibodies in our body against the flu and chicken pox and all that kind of stuff. Anytime you get an infection, you make an antibody. And the antibody goes and actually attaches to the bacteria or the virus and helps your body get rid of that bacteria or virus. So that's what the antibodies do. The antibodies are like the targeting thing that hones in on like, this thing is not supposed to be here, right? That's like what they say. And so what dapimab is an antibody. In fact, all these medicines like the Benlysta and the anifrolumab and all these medicines for rheumatoid arthritis like Humira and Remicade, all those, they're all antibodies. So we've been using this method for over 20 years, 25 years now that have been on the market as medicines of the same structure. So you take an antibody and they actually stick on the end of it something that's going to target this piece of the immune system. So in this one, it targets CD40 ligand. So it's going to find wherever in your body you have CD40 ligand floating around, it's going to go and attach to it and tell your immune system to get rid of it. And so it basically just makes your body make that go away, the CD40 ligand. And when the CD40 ligand goes away, it makes it so your immune system can't be overactive as much anymore. Right? So that's what it is. So they're antibodies. They usually stick around in your body for like a couple of weeks, and then they just kind of degrade over time, right? So that's like with all these medicines, you have to get a shot or an infusion every week or every month or whatever.
Okay.
So that's what they are. They, so it's very similar in structure and in sort of the way that we deliver it, and all the stuff that's in the liquid is the same stuff that we've been using for over 25 years to treat rheumatoid arthritis really successfully and so on. So it's not like it's some newfangled thing that nobody's done before. It's very much in line with what we've been doing for a long time.
So this particular thing, this will be like a shot or infusion or injection, or is it a pill?
Yeah, it is. Right now, what we're testing right now is an infusion. I think it's a once a month infusion.
Okay.
And the way that most of these drugs go is they start off as a once a month infusion, and then often they become a shot. But that they usually have to do another set of studies to prove that works.
Okay. So what are some things that you wish more patients knew about their treatment options or their role in research conversations like this?
Mm-hmm. So I'm going to take that as two parts, right? So
yes.
In terms of the medications decisions, right, sort of like the role that patients can play there, I think it's really important that patients ask their doctors all those questions, right? So like the question of like, well, what's really in this stuff is, I think, often a question that patients have in their brain, but don't say to their doctor, right? You didn't even want to me, right? And like, if that's what's going to keep you from taking the medicine, then you should just ask it, right?
Right.
Because the most important, like prescribing the medicine isn't what I'm trying to do.
Right.
I'm trying to get you to get better and
right.
take medicine, right? So letting the doctor know what the things are that are making you nervous about taking it, what's hard about it, what scares you about it, or once you're taking it, like what's bothering you about it. Your doctor wants to know about that and have the opportunity to talk with you about it and answer your questions, and can most often probably reassure you about sort of the risks and benefits and that kind of thing. But it's really important that doctors know what's important to you and what's worrying you, especially.
Yeah, I think that just for me having lupus for so long, going into it in the beginning, I didn't know what to ask. I was just taking whatever they gave me, because all you want is that help, that pain to go away. Just fix it right now. And as I've gotten through it, I'm just like, what is the most simplest way to get the results that I'm needing and, not take all of that stuff. So many of us are living with both faith and frustration. What encouragement would you give lupus warriors who feel like the medical world is moving too slow, or it's just missing their voice completely?
Yeah. So that's a great question. I mean, I think that lupus is really has made huge advances in the past like 10 years, right? It doesn't feel like it. I agree. It often feels really slow. And you look around and you see other diagnoses and other diseases that feel like they're going faster, because to be honest, somewhat they are going faster, right? Lupus has been a bit of a slog, like it's slow. There's been a lot of drug trials and a lot of drug trials that have not worked. And so I know that patients are frustrated. I can tell you doctors are frustrated too, because it feels like it's taking a long time. I do think that we are making progress. And I think that in my experience, we can get almost every patient a lot better on our medicines, right? I think that what often happens, though, that I see is that patients get frustrated that they're not getting better faster. They are frustrated by the symptoms that often don't respond so well to our medicines. So for example, I was talking earlier about the fatigue and kind of chronic pain of lupus. In our experience, and we study this a lot here at Duke, um, some patients that gets better when their inflammation gets better, right? And we
Mm-hmm.
see that when they get on a medicine, they get better. And in fact, in this study with the dapimab, the patients whose arthritis got better, also their fatigue often got better. There's another set of patients, however, who are living with lupus who kind of just chronically have fatigue and pain that doesn't seem to vary all that much with disease activity. And our medicines don't really have a big impact on that component of lupus. And so we're studying to try to figure out sort of why that is. We think that there's probably multiple different things that are causing those symptoms.
Right.
Sometimes it's inflammation. Sometimes it's another problem altogether, like a thyroid problem. Sometimes it's lifestyle stuff, like not being able to sleep at all.
Mm-hmm.
Sometimes it's from prior trauma. And, there's definitely a very strong mind-body connection.
Right.
In that prior trauma can often sort of manifest with a lot of physicality and physical symptoms. And so there's like a huge range of causes for those symptoms. And I think often in the lupus world, it's kind of all called lupus, but I think it's sometimes not. So it feels like aren't helping, right? And stuff we really want to have get better doesn't always get better. And I think that's very frustrating and unfortunately par for the course in a lot of our lupus patients. So at Duke, what we do is we sort of get the inflammatory parts better, and then we start thinking about like, well, what else do we need here?
Yeah, it's kind of like just when you're healing altogether, you can't just heal the mind by itself, or you can't just heal the physical body by itself. And even when it comes to spiritual, like you have to have all of those connections to fully heal. So even if you are taking medicine, your mindset has to be right. You have to eat right. You have to treat your body like it's trying to get healthy. So it does make sense that if someone had that one thing fixed, but they still have all these other aspects that just don't get completely healed. So yeah, I get it. Yeah.
I understand. We all understand the frustration. I can tell you, it also frustrates your rheumatologist.
Yeah, I bet. So, how can people in the lupus community stay informed about the progress of treatments like this one or even participate in future studies?
Yeah. So there are definitely opportunities to get involved in studies, and I think that that's something that is important and will help the lupus world move forward. So there's actually, this is not the only drug study that is out there, right? There are multiple other medications that are currently being studied in phase 1, 2, and 3 level studies, right? So there's lots of different studies, and they're very slow to enroll. Like it takes currently years to find 300 patients to put into one study. That is because you have to have a certain amount of lupus activity to get in, and there are sort of lots of qualifications. But some of that is because a lot of patients aren't interested or don't know about getting into a study. And so I think something that when I talk to patients about joining a study, we often talk about sort of the altruistic aspect and the way that by participating in a drug trial, you are giving to all of the other people out there living with lupus, that
Right.
your body and your experience and your symptoms and your side effects will help the whole system move forward, right? And so, so it's really important. Sometimes we can look at like these sort of small diseases or diseases where there's a lot of like social media around. I'm thinking of Parkinson's, right? We have like Michael J. Fox out there with Parkinson's, right? And people sort of rah around it, or breast cancer, similarly, right? Lots of people are surrounding it, and people are much, in my experience, very willing to go in those drug trials because they sort of see like, oh, this is how we all move forward. And I think that sometimes that feels really strong in the lupus community and sometimes it doesn't. And I think it's a really important component that by joining these studies, like that's how you can really contribute to helping us all move forward. Yeah.
So are these studies paid studies or just some of them?
Yeah. So these studies like this dapimab study is a paid study. So the patients get compensated for each visit. It varies by study. I'm going to ballpark $100 per visit, but it varies a lot by study. So yes, so patients are paid to be in it. They usually have to get seen at the sort of place that's running the study monthly, usually for about a year, and then sometimes monthly or maybe every couple months for another year or so after it. Often, once you're in this first study for a year and you're randomized to either drug or placebo, they often have what they call an open label extension, where everybody can go on drug, on the study drug, and stay on that often for a long time, like sometimes years and years until it gets approved. So you can actually, continue getting care. Often those, and actually always, those visits are free to you. So
Right.
you're not paying to go see the doctor, and often you're getting paid to do that. And they can often help, especially pay for like travel, right? Because sometimes you have to
Okay.
drive a long way. Some of them even have money to reimburse for childcare, right? A lot
Oh, okay.
of lupus patients have young children and
Mm-hmm.
they just leave their child at home all day by themselves, right? When they drive 2 hours to go to the place to get the infusion. And so, so there's ways to get childcare reimbursed, travel reimbursed. We've had patients who come like 4 or 5 hours to our center
Wow.
and they stay at a hotel overnight, and that gets paid for by the study. So that the companies really want these drugs to get studied and approved, and so they are willing to pay the sort of amount that is required to really make it feasible for patients. And they're very aware that lupus patients are not like a bunch of older retired people who can just have
Yeah.
time, right?
Yeah.
Like they have children, they have jobs, they whatever. And so they're very conscious of that. So there's a lot of ways to help make it more feasible to do it.
Yeah. And a lot of us are being diagnosed so young. So it's like even just not knowing like what is lupus? Like my body, even at a young age. So what are some of the things that you are most excited about the future when it comes to lupus care?
Absolutely.
Oh,
So first, I want to tell you what I'm excited about with this medication, right? So this
okay.
medication, the study really showed that there was really nice improvements in lupus activity symptoms in some patients as early as 12 weeks. And when they did the whole study out for the whole 48 weeks, a lot more patients who got the study drug compared to regular or compared to fake drug or placebo got better. So we had less less inflammatory symptoms, half the number of flares in people who got drug versus people who didn't get drug. A lot more people, almost 70% of people, were able to taper down their prednisone pretty significantly who got the drug, and it was really well tolerated as well. So there weren't really any major side effects. We do expect, like just with basically all lupus medicines except for hydroxychloroquine, it increases the risk of infection a little bit, but not to a level that was at all really worrisome or dangerous in the general
Hmm.
population. And a lot more people got to low disease activity. So I feel like this drug, just like some of the other biologics that are coming to the market, like the belimumab and the anifrolumab, are really helping to change lupus symptoms for some patients. So I'm really excited about that. Also, to circle back to some of the medicine stuff we were talking about with how it's like hard to take 20 medicines, I actually really like that this is an infusion and hopefully eventually will be a shot because it's like a set of medicine less you have to
Yeah, 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 it is.
right? So in the study, everybody stayed on what they were already on, right? That's like how all these studies work. But ideally, in the future, what we're going to end up with is patients maybe are on hydroxychloroquine and one of these medicines, like, right? So you take hydroxychloroquine every day and you get your infusion once a month, right? Like, how much
Hmm.
better would that be than the current fist of medicines you take every day?
Yeah, that's currently like my situation. I'm on Benlysta. I've been on it for almost 2 years.
Mhm.
And I started out with the infusion. I think that was like at the beginning of it. And then I, went over into the actual shots and injection. And that's worked for me. I mean, I take prednisone as needed, and that's not often.
Great.
And hydrochloroquine, and I was on methotrexate, but I don't, no, it was Cellcip. And I just don't really need it with just the
Mhm.
injection, honestly. So I'm grateful for the people who put in the energy and the time where I don't have to take all those pills. And yeah.
Yeah, I think that that's how we're really finally going to get lupus better, is by
Hmm.
making regimens and plans and medicines that are easy to take, right? Like that's how other diseases have gone. And like, um, it used to be that you had to take like 5 medicines to treat HIV, and now you have to
Yeah.
get a pill.
Hmm. Yeah.
It's super complicated, and it's gotten down to something really easy to do. And I feel like lupus just hasn't made that transition yet. There hasn't been a strong emphasis on that transition, I would say. But I hope that there really is, because we need something that young women, especially, can just take and then live normal lives, right? Like that's what all of our patients deserve. And I think that I hope that we could get there.
Yeah, I agree. I do, but I do feel strongly about the whole experience of healing, and that the medicine or taking that injection or infusion is not going to be your saving grace only. So I'm speaking from my own personal experience. Like, yeah, I'm on this injection and it helps, but I also work on my mental. I work on what I'm eating, what I'm drinking, what I'm doing in my environment to stay, in this space. So it's just not about a 1 day fix or a 1 month fix of me feeling well. Like, it's a lifelong thing. So, yeah.
I can't agree with you more. And even people who don't have lupus, in order to live long, healthy lives, need to do the same thing, right? That like
Yeah.
being, moving your body in a way that feels good, and eating food that's healthy for you and makes you feel good, and sleeping and dealing with all the mental stress of the world. Like we all need to do that, but especially our lupus patients, I think um, it's like it got like all that got gets so disrupted when you get lupus and you're young. I think
Yeah.
it feels like I think an even harder struggle for a lot of our lupus patients. And then when you flare and you feel bad, it's like hard to keep up the stuff. Um, but no, I totally agree. It's not medicines are not the entire answer to living a healthy life with lupus.
So, what would you like to leave my audience with? Something uplifting, some kind of reminder, or something that you'd like to share?
Yeah.
Ex-
All right, I'm gonna go off script a little, but so here's my other thing that is my soapbox, and that is about pregnancy, because
I'm sorry, I was gonna ask you that because I was like, should I just tie the two together? Should I have it on again? Because I really want to have that conversation with pregnancy because,
love to come
yeah.
back and have a pregnancy conversation. So I will give the short version, and
Okay.
and that is my uplifting message to women with lupus is that almost every one of them can have a healthy baby. The key to success is planning, getting pregnant when your disease is well enough controlled, getting pregnant when you're on medicines that are safe in pregnancy, and then staying on those medicines throughout pregnancy. If we do that, we have not every pregnancy goes perfectly. Some of them are a little scary, but that gives us such a better shot at having a healthy baby and a healthy mom at the end. And it is really like one of my key missions in life that I really help women move from having sort of falling pregnant when things aren't really ready from a lupus standpoint to be pregnant, and then just suffering the tragedies that happen from there.
Yeah.
It's
Yeah.
heartbreaking for me, and it is heartbreaking for patients and their partners and their mothers, and right. And I, some of that, not every bit of it, but some of it is avoidable with planning. And so that is my other sort of thing, is talk to your rheumatologist early about pregnancy. Before you even think you're ready, that's when you start having the conversation that you might be thinking about pregnancy, and really work with them to get you all the way ready to have a safe pregnancy.
Totally agree. I feel like that's basically my journey. I have two daughters, and it was because of proper planning. And I think my doctor, actually, it wasn't even my rheumatologist. It was my kidney specialist. He was looking at my blood work, and he was like, you're young. If you want to have kids, do it right now. Your blood work is perfect. It's showing like if you want to do it right now.
Yeah.
And I took his advice. So yeah, I agree with you.
Yeah. So we'll come and talk about that again.
Yes, please. I would love to go deeper into that.
I would love to.
Well, thank you so much for joining us today. I really appreciate everything, all the tips, all the information that we could use for these trials. And this medication seems like it's going to be something that's really going to help.
I really
hope. Thank you again.
Excellent. Thank you so much for having me. I really appreciate it. And you're doing great work. I love this. It's fantastic.
Thank you. And until next time, you guys, peace and be intentional. Bye. Whew. Wasn't that so good? I'm so grateful to Dr. Cloves for not only breaking things down in a way that makes sense, but for truly seeing us, those of living with lupus, trying to plan a life while managing something so unpredictable. If this episode sparked something in you, or even just gave you a little clarity, I'd love for you to stay connected beyond the podcast. Make sure you're subscribed to my newsletter. That's where I share gentle planning tips, mindset shifts, and real life tools to help you stay grounded while navigating chronic illness. You can sign up from the link in my show notes or the bio. And if you're craving deeper support, check out the Chronically Planned Inner Circle. It's my soft space for planning with faith, flexibility, and real community. We're building together 1 week at a time. Doors close on May 25th. And until next time, take care of yourself, because you're not just managing a diagnosis, you're planning a life.